A new biography of the late Steve Jobs is about to hit the stands, and it offers some unique insight into the life of the former Apple CEO. 60 Minutes correspondent Steve Kroft sat down recently with the author, Walter Isaacson, and talked about Jobs' controversial decision to delay surgery to treat his cancer.
And then they do a biopsy, and they're very emotional. They say, this is good. It's one of these very slow-growing 5% of pancreatic cancers that can actually be cured. But Steve Jobs doesn't get operated on right away. He tries to treat it with diet. He goes to spiritualists. He goes to various ways of doing it macrobiotically, and he doesn't get an operation.
Why doesn't he get it operated on immediately?
You know, I've asked him that. He said, I didn't want my body to be opened. I didn't want to be violated in that way. He's regretful about it. And his wife, who's a very solid, decent person, understood it, but said, no, no, the body is there to serve the spirit. You should get this operated. And soon everybody is telling him, quit trying to treat it with all these roots and vegetables and things. Just get operated on. But he does it 9 months later.
Too late.
Well, one assumes it's too late because by the time they operate on him, they notice that it has spread to the tissues around the pancreas.
How could such a smart man do such a stupid thing?
Yeah, I think that he kind of felt that if you ignore something, if you don't want something to exist, you can have magical thinking. And it had worked for him in the past. He regretted it.
And here to discuss Jobs' choices, oncologist Dr. Diane Reidy-Lagunes. Great to have you with us, Dr. Reidy.
Thank you so much for having me.
So you watched this. It's pretty shocking as a revelation to hear he didn't get it treated. Do you think, I know it's hard to discuss because you don't know everything about Steve Jobs going into it, but do you think things may have gone differently had he received treatment earlier?
Right, so I think it's first very important to distinguish the type of cancer that he had. As we know, he had a type of very uncommon cancer called pancreatic neuroendocrine tumor. Very, very different than the typical pancreas cancer called adenocarcinoma. The adenocarcinoma is on the order of just several months overall survival, whereas neuroendocrine tumors, generally our patients can live for several years, just like Steve Jobs did. However, almost all of our patients do pass from their disease. It's a slow-growing cancer, and again, I don't know, like you said, what his images showed at the time that this was diagnosed, but I can say on a statistical basis, most of our patients, even when we think we're taking them to surgery for cure, they recur. So most of our patients with neuroendocrine cancer have this cancer come back. Having said that, surgery is the only option for cure if it's localized and it hasn't yet spread at the time of diagnosis.
So you're saying that essentially he could walk away cancer-free had he done this, perhaps, but that it could have come back as well.
Exactly. And also, it's this is a cancer because it's so slow-growing. Often we take them to surgery even when it has spread, but that's not for curative intent. It's to try to take out as much cancer as possible. But again, whether his cancer was ever curative, I don't know. I don't know if anyone would know. Even if the scan showed it was only in one spot, the truth is, again, most of our patients have the cancer at a microscopic level at another place and probably would have come back.
As a doctor, what do you think about alternative methods? Because many people do, when they get that prognosis, they do pursue them.
Right. So as an oncologist, you know, I actually studied nutrition as an undergrad, and I think it is very important for prevention. Cancer oncology treatment is based on data and evidence. There are no data whatsoever to support the use of nutrition, alternative therapies, or vitamins to treat cancer. It just doesn't help. We wish it could. It doesn't. And in fact, we have a couple of studies to show that IV vitamins can actually make patients with cancer do worse.
Really? Well, Dr. Reidy, we really appreciate it. Thank you for being with us today.
Thank you so much.